Okay, since today we are in a mood for learning various terms, let us learn a few more terms. These are important terms. Suppose we take this example where I have got the system is a patient and we have got number of inputs. I can see that I have got medicine here, then I have got gender, and then I have got blood pressure before the medication, and the output is the blood pressure after the medication. And we of course have random error. Now in this case you can see that these inputs, they are categorical, the factor, then factor, and then this one, blood pressure before, is a covariate. So we have already distinguished them according to whether they are categorical or continuous. But there is yet another way by which we can distinguish them. It is like this. Consider this input, which is the medicine. Now that input is something which the doctor, the experimenter, introduced in a voluntary, in a deliberate way. So you applied the medicine. And such a thing is called treatment. So by a treatment, the term itself comes from clinical studies. We mean something, some input, generally categorical, maybe a covariate thing, which is administered in a conscious way. So such a thing is called a treatment. On the other hand, gender, that is not administered in a conscious way, so that is called a control factor. That's kind of weird terminology because the thing that you can control is called treatment, the thing you cannot control is called the control factor, but that's the term that has come to be stuck. So by control factor we mean something which is already there, you are not applying it, and it could be, so it need not always be a factor, it could also be a covariate, but generally the term control covariate is not used. For example, if you take this blood pressure, so that is also not administered by the doctor. So we generally reserve this term treatment and control for factors only, though the same concept will also work for covariates as well. We just do not use those terms generally. So the term treatment and control factor are reserved only for the categorical inputs. So these are the two terms that we should remember. Now just as in case of factors and covariates, we have certain terms. So if we do not have factors, then we call this this. If we do not have covariates, we have a different name for that. Similarly in this case, so if we have a situation where we have got at least one treatment, that is there is at least one input which is consciously applied by the person who is carrying out the study, we call that a statistical experiment. Experiment you understand because you are consciously doing something to the system and looking at the output. Statistical because we are taking random error into account. If on the other hand you do not have any treatment, then all the inputs were already there, you are merely a passive observer, then you call it an observational study. In various social study scenarios, that is what happens. You are not changing anything. You are merely looking at the system as it is. You are merely taking some students, possibly from Bengali medium schools and English medium schools, and looking at their, say, final score in class 10 examination, and you are trying to assess whether medium has any effect on the score. That will be an observational study because you did not change the medium consciously. Every student came with his or her own medium of education, and then you merely observe the scores, which are the yield, which are the responses. So that will be an example of an observational study. So in this lecture we learned certain standard terminology. You will see them all over the place. This will help you to read standard literature.